Welcome everybody to another KVDL webinar. I'm Greg Hanselchek. I'll be your moderator for today. Special thank you to all of you participants that have joined us before in our previous webinars. And a great big thank you to first timers here today. And speaking of those that have joined us for the first time, just a few things to cover before we get to our special presentation. Number one, we will send, if you stay with us for the entire webinar, we will send you a certificate where indicating that you've had 1 hour of CE. Give us about 2 to 3 weeks to send that to you via email. We will also, this is recorded, so these webinars are then planted on our YouTube channel, so just search for our YouTube channel. There's a whole bunch of different webinars and videos on there. Another thing is that we very much at the end, we want to get feedback from you all about what we're doing right, what we need to improve on, and particularly there'll be a question on what topics in the future that you would like us to present to you. I just want to give you a little heads up. In our October webinar, we actually have a entomologist from Kansas State University who is a tick specialist that's going to come in and talk about the Asian longhorn tick. We had our first case of native-born, native-raised cow with clinical filaria yesterday. So we know the tick is now at least in eastern Kansas. So she'll be here to talk about the biology of the tick. It's very interesting, and then some treatment and prevention methods to use in the tick. The other thing I want to mention is that we will please send your questions either through the chat, which if you do that, then everybody will see who, you won't be anonymous, what I'm saying. If you want to be anonymous, just use your Q&A at the top of the screen, and then you'll be anonymous. Your questions will be. We're going to save the questions till the end, and then I'll present those to our specialist today. And anything we didn't get to, if you feel welcome to, or we welcome you to contact our special guest today and ask questions via email anytime after the webinar. So with all that, it's my great pleasure to introduce Dr. Roman Pogranichniy. He's actually our section head for both virology and serology in the KVDL. He got his DVM at the Ukrainian State Agricultural University. He then completed an MS and a PhD at Iowa State University. He is a microbiologist and a virologist. His specialty and as far as knowledge base and interest are viral infectious diseases. He spends a lot of time both nationally and internationally as an invited guest to go around the world and talk about multiple of different viral and infectious diseases. So we're very fortunate to have him come here today to talk about a small animal disease, FIP. I think you're all familiar with that, Feline Infectious Peritonitis. So with that, I'll turn it over to Dr. Pogranichniy.
Thank you, Dr. Hanselchek, for such a kind introduction. It's my pleasure to be here and speak to you all. And yes, I did my master and PhD at Iowa State. That's where I focus more on the pig diseases, and I continue working on the pig diseases. But today, I would like to talk about feline diseases, specifically about feline infectious peritonitis, and pigs, as you can see on the picture, will be on the background today. Also, I spent quite time in the veterinary diagnostic lab in Iowa and also in Indiana, animal disease diagnostic lab before. It's my 7th year here. I'm on my 7th year here at the Kansas Veterinary Diagnostic Laboratory. But all this time when I spent in Iowa and Indiana, I picked up this accent and I'm trying to get rid of it. And now working my Kansas accent now. So be bear with me on that. And we will move on and focus on FIP. I just want to give you a quick introduction to this disease, to this virus, and outcome. We would like to talk about differential diagnosis for FIP, and more important, the best diagnostic approach for FIP treatment and outcome, and some conclusions. It is a very complex disease. I like complex diseases, and also I did some work in this area. I have some publications in this area, so I would like to mention them as well as we go along and discuss this topic. So, as virologist, I would like to talk about viruses, and viruses I like to present as a picture of the viruses. So here we actually see picture of coronaviruses, because FIP belongs to Coronaviridae family and has this nice envelope that you can see. And because of that nice envelope, that's why this family called coronaviruses, they are on the electron microscopy pictures, they look identical. There's many members of coronaviruses belong to this one, including canine corona, bovine corona, porcine epidemic diarrhea, transmissible gastroenteritis, even the SARS virus, the famous SARS virus, belongs to Coronaviridae. So, and they will look identical on the picture. So it is single-stranded RNA, and it's very important, in my opinion, and it's very small virus, about 80 to 120 nanometer in size. So why it's important that it's single-stranded RNA? Because RNA viruses prone for mutations. So every slide that I have for you today, it's interconnected to the conclusions that I will have to you on the end. Even it's a kind of review of viruses, but you want to know about pathogenesis, you want to know about the diagnosis. All these are connected. So this is a very short summary of things that are there published on feline coronaviruses and corona overall, but there is a connection. So RNA viruses prone for mutation. It's important to remember to move forward to understand the next following slides with me as well. We will zoom into that more in details with you, okay? So a little bit more in details of feline coronavirus. We know feline coronavirus that cause enteric disease, and quite often non-pathogenic in cats. And there is another one that we call it FIP, Feline Infectious Peritonitis, that causes systemic infection, respiratory enteric disease, and so on. And also there is this SARS coronavirus, the SARS coronavirus causes disease in cats as well. Belongs to beta corona group 4, and a group and alpha corona. This is feline coronavirus. What's important from this slide to take home message? They are cross-reacting. Those viruses, they can infect cats, and they can cross-react on different serological assays that we'll discuss later. So that is important. There are so many viruses that can infect cats, and they cross-reacting down the stream, but they are different on inverse of diseases they can cause overall, specifically for when we focus on FIP. So I really will have to zoom in on the viral genome here to the spike protein. It's an important protein for this for feline coronavirus, because a lot of things happening around this protein. This is on the cartoon. It's this protein, the spike proteins right here. There's also structural proteins like membrane and nucleocapsid and envelope. They help virus to stay intact and replicate and infect other cells. So on the electron microscopy, you cannot explain exactly all these different procedures. But spike protein, it's very critical if we want to understand the pathogenesis for this particular virus that we will talk in a second. Okay, we will get to that. And so, why is this S protein so important? It's important because it's capable to induce neutralize antibody. It's hemagglutinin, also involved in hemagglutination assay. But more important, on this protein, we have mutations that have been diagnosed as we following as this FIP infected animals, cats, that caught the switch from this avirulent feline coronavirus that cause enteric disease to more lethal FIP infection, and mutation happening at this region at 1058 when we have methionine replaced with leucine. That is amino acid replacement. That's a single mutation. And also at position 1060 where we have serine replaced with alanine. Someone would say, okay, this is just two amino acids that happen these viruses all the time. It's RNA virus mutating, but this is a critical mutation that induce and move virus into switching from feline corona to actually FIP. Those two amino acids become a mutant virus that is lethal. Just two amino acids. Do we know any other example of that happening with other viruses? Yes, we do. Influenza is very famous on that. Also has just few mutation on this single gene that will change pathogenesis. Same thing apply here for feline coronaviruses. So that is the critical component to understand and connect later to pathogenesis that we jump very shortly here. So how prevalent is feline corona in population? There is many different publications on prevalence. In many different countries will be different numbers in a different population, different testing method, it will be different. I try to just summarize what I found for US population and what is relevant. So like feline coronavirus is quite prevalent. Between 56 to 90% will be in the kittens and other age cats as well. And but more important, what I find very interesting, so the FIP as disease are prevalent and examined on more than 11,000 cats, 11,535 cats. The 0.5% only prevalence of, according to those population. And those studies that were done that we have. So as you can see, we have a lots of coronavirus out there in population circulating. Some people, animals will shed this virus for a long time, some for short time, but using PCR, which means detection of pieces of RNA of the virus. What about prevalence for antibody using different serological method like ELISA or IFA? The level of antibody we can detect in those population of cats is even higher, between 85 and 100. So in other words, majority of animal will have antibody present to feline coronavirus. And it's important to mention we do not have a ELISA method or serologic method that can distinguish between feline corona and FIP virus. We basically detecting total antibody. And I will zoom into that more in detail, explain later, but it's just to understand the prevalence of antibody spreading of the virus. And especially if someone like to use a diagnostic method, serology, for detection of feline coronavirus. And 10% of cats never have serum antibodies detected overall. So this is important kind of background information from the literature, so we can understand few following slides more in details. Okay, the transmission fecal oral is very common, and virus infected cats will shed virus for a long time, sometimes for a lifetime, and not many, but few. Majority of cats will respond to this non-pathogenic feline coronavirus, and virus immune system will be activated, and virus will be eliminated, and there will be no shedding. Okay, but virus can mutate, and reinfection is possible with feline coronavirus, and more important that all breeds and ages of cats are susceptible to FIP. males seems to be more like male cat, more likely will develop FIP virus. And there is some cats that never shed the feline coronavirus, but they consider to be resistant to this virus. But it is very small population, and then of course more studies. So probably pathogenesis. It is a critical. It's a critical understanding what's happening. So we have this non-pathogenic virus that we call feline coronavirus that replicates in epithelial cells and enterocyte in the small intestine and will be shedding fecal material. For majority of cases, it's 2-3 weeks and that's it. But then some can shed for a long time, and some of the cats will show no clinical signs, even they have replicating virus. Okay. So what happens next? If this non-pathogenic virus start changing, we have virus become virulent, and virus start replicating in monocyte, and cells will lose it. But more important, virus replicate in monocyte and macrophages. We have that mutation happens that allows change of virus tropism to these particular cells. Up to now, if it's non-pathogenic, virus does not replicate in macrophages. But when you start replicating macrophages, that is very strong indications that we have different virus that is now can lead to FIP development. Okay, so what happened there when the replication happened? There's two important things happened that virus break down this endothelial tight junction, allow plasma to leak out of the vessel. That we see effusions and abdominal, thoracic, and pericardial cavities, and we have this metalloproteinase that destroy collagen and in a basal lamina that affect the vessel, so that we have the leakage of the fluid from vessel. That is, we call it that form of FIP. And there is some in the chronic phases of FIP. Sometimes this happen as well. Those we don't see those few blood vessels are affected and few organs are affected. But what's more important happening that FIP in virus, this mutant virus, suppressing immune system. Viral protein is not expressed on MHC1 complex. So if viral protein is not expressed on this complex, cells cannot be lysed. That means infected cells cannot be destroyed by T cells. And what that means that virus can replicate infinity until the death of animal and keep destroying the cells when it's because eventually after replication virus done, virus will kill the cells. So those natural killer cells, regulatory T cells, are really suppressed during FIP infections, which is critical part of immunopathogenesis for this virus. Virus learn how to suppress those cells so virus can replicate and cause disease. And so if we can reactivate those cells somehow and block this suppression, then animal have a chance, okay, to survive overall. So when these T cells are, not suppressed, we have chance of those animals, those cats will recover, and we will see clearance of the feline coronavirus overall. So as you can see, pathogenesis here linked to two things: mutation of the virus and immune system of animal is suppressed. So if those two happens together, leads to lethal infection that is has bad outcome for patients. Okay. Maternal antibody are protected, and so if they develop, they to that particular virus strain, there is a chance of virus clearance. So majority of you will see very specific clinical signs for FIP with anorexia, weight loss, icterus, pale mucosal membrane, lethargy, neoplasia, change of iris color, some neurological signs, seizure, head tilt, and so obviously virus will infect the brain tissue, spinal cord, and so in that form of FIP, we'll see infusion. Infusion, that's a critical component of that form of FIP and glomerulomatous lesions in CNS, liver, kidney, and so on. And infusion will be in abdominal, a pleural infusion, and a pericardial infusion. In dry form of FIPs, we will not see infusion. However, outcome in those cases is sudden death. In a couple weeks, 1 to 3 weeks, you will see a sudden death of animal if there is no intervention done to this particular cases. So there should be a differential diagnosis of FIP. There's many other diseases that are listed here, like neoplasia, toxoplasmosis pancreatitis, congenital heart failure, mycobacteriosis, retrovirus vena trauma, and other ones should be on differential list for you. That's why diagnosed clinically, it's not so simple FIP. That's where a specific diagnostic assay needs to be applied in order to accurately diagnose this disease in cats. And we will talk about this testing in a second. Okay. One of those diagnostic tests that you probably will do is look some of in your clinics. Some of them you have to send out to see. So one of the clinical examination it has been suggestive that more likely will lead to FIP diagnosis. It's just suggestive that we will have a fever in those animals. Will have fevers. We will have effusions, as a highlighted like 3+ or more, ataxia, seizure, and some neurological disorder, behavior change of color in iris. It's very important. It seems to be suggestive, so that's more likely will lead to FIP diagnosis down the road. And of course, the fluid. Enlarged you can do clinical examination and palpation. Enlarged kidney lymph nodes also would be suggestive to FIP. All other symptoms as not as critical, but they are present during FIP clinical presentation overall. Okay, so on the serum biochemistry, when you do blood analysis, it is notable. We cannot make final diagnosis of FIP using those testing, but if there is a hyperbilirubinemia, hyperglobulinemia, it's more suggestive to FIP. If we have IgP more than 3, even 1.5 gram per liter, it's already suggestive of FIP diagnosis. And talking to Dr. Hernandez, I don't think they would make diagnosis based on these parameters in our ClinPass department, but they would suggest additional testing that can be done in veteran diagnostic lab here, and we will talk about those testing in a second. Okay, hematology, there will be some mild non-regenerative anemia, severe to not regenerative anemia, but this is not specific diagnosis of FIP. Okay, it's very there's 2 pluses here, so it's very suggestive, but not specific. So collection of the fluid, it would be very critical. We need to analyze some material for diagnose FIP, and so there is a video for you how to collect this effusion, because having this effusion will help us to detect actually the virus in macrophages. So this video does not have a sound, but it will show you example how we can be collected. That is actually available also online, and it's reference to this a paper from North American Small Animal Practitioners. Okay, so, but I think collection of those infusion fluid, it's very important. That's something we can test here in veterinary diagnostic laboratory, and we can provide you accurate result of diagnosis of FIP. Okay. There is so-called point-of-care test called Revolta. So it can be done even in-house, which basically requires only to have distilled water, citric acid, just 20 microliters or 1 drop, and 1 drop of this ascites fluid. And you can drop it in a tube, like it's shown right here. And if this drop is dissolved, it's unlikely will be FIP. If this drop is stay solid and kind of settle on the bottom, like you can see, it will be suggestive to FIP. It is not specific test for FIP, but it's been used in some practice overall for to take the next step, or in diagnosis FIP, that every time there will be a next step. So I want to show you a good samples. This is a good samples that we would like to receive and analyze for presence of FIP virus, for feline coronavirus in macrophages. And this is a bad sample that would be very hard to work with and get accurate result out. So that is important. So what we can do on this infusion, we can do FA diagnosis, or we can do PCR to detect FIP in those. And gold standard for detection, for diagnosis of FIP is histopathology with immunohistochemistry to detecting coronavirus. But on live animal, when you have infusion, we can quickly spin the cells down, macrophages, and using direct FA method or other method to detect a virus in the macrophages. Remember, when virus mutate and start replicate macrophages. Before that, virus did not. So detection virus macrophages, indicating that we more likely have FIP diagnosis. You can also detect the virus in a tissue by doing biopsy, do histopathology, but that's not as critical. But this would be a less invasive method by detecting the virus. So as you can see, we have many different cells, and this green dots, that is infected macrophages, that we with confidence can say, yes, virus is present in macrophages, and we are detecting this virus there. So FIP more likely there. Many people publish paper on this, and I have some publication on this method detection. It's pretty specific, 100% specificity. Sensitivity can vary, depend on the quality of samples that we receive. If we can receive a good quality of samples, we get a good outcome. But it's pretty accurate diagnosis of FIP. Okay. In most cases, we here, that form of FIP, we will see about 80% of cases, we will see abdominal infusion, icters, lungs are dark red, mesenteric lymph node enlarged, there are lots of icters, lots of fluid, and that's a courtesy of Dr. Plattner, who is our pathologist, who they took all this picture and they share with me. And also the gross lesion with a dry form. With the dry form, we also see this enlarged lymph node, contains a foci, enlarged kidneys, but we don't see as much fluid there. So nevertheless, grossly, it will be suggestive further. We need to do histopathology on this slide, but our pathologists will look and see if there is granulomatosis perivascular vasculitis, perivascular inflammation, and the infiltration of the cells, necrosis. And this example is of the liver. But definitive diagnosis comes with immunohistochemistry of detection again, infected macrophages or monocyte with specific antibody for coronavirus. So we have combination of lesions, histolesions, and we have detection of virus in the macrophages. That is the gold standard diagnosis of FIP. It's never, it's very accurate detection. All previous methods would be suggestive of FIP for sure. PCR method is good if it's available. When we talk about PCR methods, there are many different methods. It means that they detect in different genes of feline coronavirus, AM gene, S gene, and they are different design of those primers that have to bind to the specific target, and so in the different sample population and so on. So yeah, detection of genome of feline coronavirus, it's good, especially like in the specific samples like an infusion or other one, but it's not confirmatory for FIP because we still don't know if there is a mutation on that S gene, and that's its critical part. And we don't know if the virus replicates in macrophages. But previous two methods, definitely, that I described, immunohistochemistry and direct method FA or some other methods of on the blood will tell us that virus does replicate in macrophages, okay? Would like to mention a little bit about serology. We do offer serological tests for coronavirus, and we offer IFA. That's where we detect antibodies to coronavirus. This is not specific test for FIP. It's a method to detect antibodies to coronavirus protein, feline corona enteric virus, non-pathogenic, and the pathogenic as well. So we detect all the different antibodies that respond to all the different those molecular structural and even non-structural proteins on this method. So it's just general detection. The antibody are present to coronavirus. And this method, serology method, normally are not recommended to diagnose FIP because remember the prevalence antibody was very high. This is not specific method, and more important, 10% of cats never develop antibody to to coronavirus as well. So you will misdiagnose if you're using serology. If you have a positive, you will misdiagnose if you have a negative. And so that's why it's not recommended. The serology method is not recommended to detect. If you would like to know if your animal, if your cat have antibodies, yes, that's fine. And so interpretation of those test results are critical. As you can see in Kansas State Veterinary Diagnostic Lab, we have several, we have immunohistochemistry. We do run those periodically that accurately detect FIP in animal, and we also run antigen detection in macrophages. And that means that we are diagnosis. The key component I would like to mention here is that not all the infusions that we are testing are positive. That means that not all the cats that have infusion automatically have FIP, okay, and not automatically is diagnosed for FIP virus. So there's like 20 over the years, there's between 25-26% of positive samples of all the tested there. But it is the detection of feline coronavirus in macrophages, a good anti-mortem detection of that virus, a diagnosis of FIP. So why serological method is not good? Because there's lots of cross-reactivity with many other viruses that I mentioned at the beginning. There's many coronaviruses and many serological methods, they are cross-reactive. So I want to give you an example for SARS, because SARS coronavirus is a very famous virus. We still remember that. We did some investigation study, see, what is the prevalence of this antibodies to SARS in cats. And actually, collected more than 200 samples from different states and tested for different serological assay. Just to see, do we have a SARS replicating actually and causing immune response in animals? And it does, about 4 to 6%, on depend what assay we're using. If you're using specifics like virus neutralization assay, we will have about 6% of cats will have antibody to SARS as well. What drew our attention here, this response 31% on analyzer. That's a nuclear capsid antibody that are detected against nuclear capsids of SARS protein. So why there's a difference in this assay there is more antibodies versus other ones, because this assay is not specific for SARS, and for this ELISA it's more general. Okay, so when we look very close on many different assays, we determined that yes, you have this antibody to SARS that's specific, but they also react with other feline coronaviruses as well. So it's kind of looking back and forward what other cross-reactivity. We confirmed it by other like Western blot assay, indicating that N protein is responsible for cross-reactivity on different serological assay, and then we using different serum from natural infected animals, from experimental infected animals, and many different assay analysis and concluded this. So as you can see, if you have IFA positive for FIP, like 73 cats, they will cross-react with on ELISA for this full genome of the full protein on the analyzer for SARS. So there is definitely cross-reactivity in that particular gene. Our other methods are less prompt for cross-reactivity, so you can design a method that does not cross-react, and we have those methods that don't cross-react with FIP virus. But take-home message from here: cross-reactivity common among different genotype of this coronaviruses, feline and even SARS. Okay, if you would like to more details, just publish. You can review this published information. There's quite a bit detail there. So let's go back to diagnosis of FIP. I think it's very critical part. That's where the confusion comes. Disease is complex and show different presentation, and everyone want to have accurate diagnosis. So I would like to focus on the cats with a heavy fusion because it's 80% of cats. So when we go here, we can go directly to the PCR or FA detection of the virus in this infusion. You can do a Revolta test just to see if you're in the right direction, and then confirm presence of FI for coronavirus there. You can then analyze the S gene because if we want to see if mutation happens there. We can analyze the other samples like liver, spleen, lymph nodes, see if the virus present there. But by PCR analysis, we don't know exactly what cells are replicating this virus. From all the literature that I review, it all goes here. Look, we need to have histopathology, immunohistochemistry done on tissue samples, and that is positive confirmation of FIP. That's the only one pass. You can do many different things, and they will be suggestive, but this is one pass to diagnose FIP accurately: histopathology, immunohistochemistry. So we need to take. So same thing with the cats with neurological signs. We can analyze fluid, cerebrospinal fluid. We can detect the virus, coronavirus in blood of the fluid or something. We can analyze the S gene, but definitive diagnosis will have to come from histopathology and immunohistochemistry by FIP testing. That is a critical component. And it's not only my opinion, it's opinion of many experts that working in this area as well. And probably most critical questions that you want to you probably will be asking, or you want to ask yourself: if cats does not have specific signs, can you diagnose FIP? And yes, you can diagnose coronavirus if you use PCR in blood and liver, but then you can do next step. If it's negative, it's unlikely. Disease will not start. If you have a coronavirus circulating at that time in the cat, you more likely will have to analyze the S gene. S gene is important, where it's coming, what tissue is coming. But again, definitive diagnosis have to be done through histopathology and immunohistochemistry on the tissue. That's where I say have in red, that's a FIP, disease is confirmed. So you can do all this additional step just to lead you to the accurate diagnosis of FIP, doing PCR or other testing that I mentioned earlier, okay? A little bit on the treatment. There is no drug available on the market that license, that to my knowledge, that is, or in publication, but there is experimental drugs out there. There is experimental study, and especially this GS441524, that's nucleoside analysis that terminates RNA on the RNA polymerase during the replication of virus, based on several studies, several publications, and experimental condition, many cats will survive with the clinical signs and of typical for FIP, because normally if cats have FIP, they will not survive. There's other experimental drugs on the market available, like remdesivir and molnupiravir and many other. Interferon omega seems to be inhibit feline coronavirus replication. Again, this is under experimental conditions and only at this time. So what to do to overall for FIP? If no intervention is available, I think it's only supportive care, some anti-inflammatory drug like prednisolone, and anti-tumor necrosis antibody seems to be helping to reduce clinical side, but overall, many veterinarian probably will make a decision or euthanize the animals or make suggestion of euthanasia if no intervention is done properly. Okay, and of course, if that decision is made, then I would suggest do final diagnosis by submitting sample to veterinary diagnostic lab for histopathology, immunohistochemistry to get that final diagnosis. Okay. Vaccine for FIP, only one vaccine is available. It's intranasal. It's a temperature-sensitive mutant, but efficacy is in question. So the advisory board of cat disease does not recommend that vaccine. So the vaccine is not recommended, is not effective. Okay, but it should be mentioned. So how can we control of feline coronavirus and FIP? It's hard, but I think basic hygiene and biosecurity to prevent the feline corona spreading between cats, and because main route is fecal oral transmission, so prevent that spreading might help. Identification of those shedders, because some of the animal can shed for life, some not, and reducing and reduce transmission of that might help. And of course, supportive care. If someone want to try under experimental conditions to use this drug, it seems to be been reported been very successful to control feline corona shedding and even treatment of FIP. So that's a promising on the horizon. If it will be licensed in the future, I think there is a suggestion and promises. Okay, there is diseases complicated in terms of pathogenesis, what the virus does for animal and how animal responds, the immunosuppression and so on, all those different mutation on the S gene, okay? But I want to summarize this to the take-home message. So it's important disease, and in cats it can be present at any age. testing infusion in abdominal tissue by direct FA, PCR, or by other method on the detect virus present macrophages. It's important. It will help you to diagnose FIP better by you have a definitive diagnosis if you use histopathology, immunohistochemistry in our laboratory as well. So in terms of diagnosis of FIP, we have gold standard. Test code is IRC 1025. That's how we do immunohistopathology for coronaviruses. And for in virology, it's VIF 2013, when we will test for FIP present in macrophages. So we can help you with diagnosis of FIP overall accurately. Okay. References, it's important. There's quite a few material out there. I would suggest this one by Sandra Felton. I use some of the information from there, and also Feline Infectious Peritonitis, European Advisory Board on Cats. It's very comprehensive analysis of all disease and what is available. It's more than 100 pages. If anyone would like to read, you are welcome, but it's very comprehensive summary of FIP. I'd like to acknowledge my virology histology team who are performing testing every day and helping you with diagnosis of FIP and many other diseases, and our patients and clients and collaborators on the projects that are mentioned in those publications. We appreciate everyone who helped along this task, and thank you for your attention.
Thank you, Ramon, for great information from the very beginning to diagnosis and treatment. I very much appreciate that. We've got several questions and we've got a little time for that. So number one question is the iris change. What's the mechanism behind the iris change? Does that have to do with the icterus, or what's going on there?
Yeah, the fluid will be there will be blood in iris, and that will change the color. The fluid filled with the blood, basically. Yes.
Okay, so and it looks like you recommend that a PCR followed up with a PCR that targets the S gene. Why not just go to a PCR that targets the S gene? And does KVDL, do we offer a PCR targeting the S gene?
Thank you for the question. That is general recommendation how people will do diagnostic workout, because coronavirus is so diverse genomic information. To design a primer that pick up all the coronaviruses is very hard. So you want to design a primer with conserved region first to make sure you don't miss any variant, different strains, detect the virus, coronavirus, and then analyze the S gene later if that PCR is available. Again, you're looking for the virus and looking S gene because mutation. You want to see if there's those mutation in that gene as well, because there's no specific method to detect that mutation right away by PCR, at least not to my knowledge. There's other following up steps like sequencing, pyrosequencing, and so on you can do, but that is kind of follow up, starting original detection. You need to know you have a virus first, that's to start with. And no, I don't think currently EDL does not have PCR for feline coronavirus or feline coronavirus S gene.
Okay, good. Can you detect FIP virus in macrophages from blood or serum, or only from effusions?
We only working with effusion at this time. We did not validate our test on other samples. I mean, it's effusion. That's what we working. No, we're not working with whole blood.
What's the youngest age of kitten that you've diagnosed FIP or heard it diagnosed?
Oh, that one. That could be all different, but there's. I don't recall specific information on age that we diagnosed. We don't look so close on that type of details. Sorry about that. Yeah.
You mentioned that the lower CT of the PCR is more associated with FIP. Can you give us a range on, is that CT under 30, or is it in the teens, or do you have any guidelines that as practitioners we could use to kind of help us focus on what may be going on?
Yeah, thank you. Yeah, if PCR is available, lower CT range means that there is lots of virus. So you will have lots of virus if virus start replicating in the macrophage and immune system is suppressed. So what is low CT? It really depend on at that time on animal, but the lower the better. So something around 20, below 20 would be good. 30 is not the lowest CT range by any means, but yeah, between around 20 that if PCR is available. Again, it's just indication there is more viral RNA in a sample. That's the only thing that will say to you that low CT.
So say we're interested in screening some cats to see if they're shedding the coronavirus. What's the best sample and best test to use in those situations?
If they're shedding?
Yeah, to determine.
Well, if it's non-pathogenic, if you're looking for if there is non-pathogenic, that fecal material would be good sample for that because virus replicate in enterocyte, and it should be fecal material. That's on live animals. That's what normal do. If you more go, if there's a systemic infection, the blood sample would be good. The serum sample would be good because at that point, virus already become change and start replicating in other tissue, in other organs, and will be systematic. Yeah. So it really depends what is the goal of testing using PCR.
Okay, we've got another really good question coming in. If you have a cat with seizures and positive for the coronavirus antibodies with a titer of 1 greater than 64,000, is there another anti-mortem test that should be run before starting therapy? And if so, tests be completed?
Well, if the animal have infusion, and that can be sent, we can see if direct antigen detection method we can use that I mentioned earlier to see if virus is present in the macrophages.
What if it doesn't have a fusion, it's just seizuring?
Well, then you go for PCR in the whole blood. I think if you detect coronavirus, that would be an indication that virus there circulating of fluid, cerebrospinal fluid. PCR would be also good to detect. Again, it's not diagnosis of FIP, it's just detection of feline coronavirus in a sample, and that would be indicative. You can always do biopsy of large organs, lymph nodes or liver or kidneys, and do immunohistochemistry for definitive diagnosis. That's what has been recommended if you want to do that invasive sampling and accurately detect virus present in the tissue. That would be definitive diagnosis in this situation.
Got another question here. Do you know how long the incubation period can be for dry FIP? This practitioner knows of an ADR cat that was over a year. So the question is, how long incubation period can be? This practitioner has had a case where it was probably a year.
Yeah. As I mentioned earlier, some of the cat will shed coronavirus. Again, the coronavirus will be present in population for a long time. When mutation happen, under what condition, it's not clear. So if coronavirus present in that population or in this animal, and some animal can have this coronavirus for lifetime without clearing, okay? And it never develop a disease as well. But at certain time, we don't know when, a virus change those 2 amino acids and then become pathogenic virus and become FIP. So it's depend on animal and the situation and environment. So it's hard to predict.
Is it possible for a cat to have FIP as determined by a pathologist but tests negative by PCR?
Yes, it's possible. Yeah. Because histopathology and immunohistochemistry is definitive, and PCR could miss. PCR is not the magic tool for every disease. Diagnostic tools, I mean, those primers and probes can miss mutant viruses, depending how it's designed. It's very tricky. It's very diverse family of viruses, so RNA is not all the same. There are lots of changes, and some changes are important for virus pathogenesis, some changes are important for detection of the virus. So if changes happen where primers are designed, automatically you will miss by PCR. You will have negative result PCR, but histopathology, immunohistochemistry will be positive more likely. Yeah.
So you did a good job of going through the diagnostic kind of algorithm. Does that change if we're talking about, which we all have as practitioners, where we have a client with really limited on the amount of dollars that they can spend on diagnostics? Is there a cheaper way to diagnose this particular disease?
Well, I cannot change the gold standard. The gold standard for diagnosis of FIP is histopathology and immunohistochemistry, okay? That's the only way to have accurate diagnosis. Okay, can we do other diagnoses that can be suggestive? Yes, like our test detection of the virus on the ascites fluid, it's cheaper and it can be done in live animal. We detect virus in macrophages, that's the cheaper method, but it's not definitive diagnosis of FIP. And so, yeah, the only way I can say you can get a cheaper diagnosis if our associate director Hesenchek waives the fee and we get histopathology and immunohistochemistry is for free.
Great answer. Because, as veterinarians, we deal with that all the time. But, and looks like we got a time for about one more question, and it's going to be mine, to tell you the truth. So I saw through your algorithms, you mentioned IFA several times, but then you mentioned that it's general for enteric coronas, environmental coronas. So to me, what would be the value of ever using IFA when we have other tests that are more specific for pathogenic coronavirus?
In terms of detection antibody, I mean, IFA and FA is confused with direct detection method. I mean, it's an algorithm, it's referring to direct detection of virals, protein, FIP, coronavirus in macrophages. That's what is this FA method, direct method, or referring to. Detection of antibodies by IFA or ELISA, it's not recommended for diagnosis FIP at all. The only value it is to say, yes, animal have antibody to coronavirus. That's how you interpret IFA serology or ELISA serology. Yeah, there's no link to FIP diagnosis at all.
Okay. Thank you very much. I think we've got time for one more question. Saw one just come through. So it says some vets look at the simple AG ratio on the chemistry panel. Do you believe significant if less than 0.4? I know this is just one test, but blood work, CBC, and chemistry panel does not always suggest FIP alone. Also, low LDH levels may be prognostic indicator of survival rate, ? So kind of a long question, but are there ways to look on basically the chemistry panel and come up with an indication that maybe this is FIP?
Well, it definitely could be indication, but it's not a diagnosis of FIP. There has to be a line, what is it, understanding. It's suggesting, but it's not, we cannot diagnose FIP based on the blood chemistry. That is important, distinguish, so, yeah.
Can we use LDH to kind of give a prognosis of what the outcome will be from the case? Survival?
Probably not, unless you have accurate diagnosis of FIP, that animal actually has FIP and there is no intervention. Yeah, that would be my, I like to be accurate and specific instead of guessing. Yeah.
And one last question. You said 10% of FIP cats do not develop antibodies. Are you talking about those cats that probably succumb to sudden death, or are there survivors that actually never ever develop antibodies?
That is coming from the literature, and it's more likely one does survivors. If a cats are resistant, that probably they will never develop feline coronavirus antibodies.
Well, thank you very much. We're just about out of time. We apologize for some of the quality of the slides, and if you'll email me, we'll try to get you a PDF copy of the notes today so that some of the information is a little bit clearer. Again, thanks to everybody for joining us, and again, we'll have another webinar at the end of October, so we'll be sending out some notifications here shortly. Y'all have a good day.